Okay, so this station is about the kidney. So in kidney, obviously you know that there are two kidneys. There is the, we'll go here first, the right kidney which is lower and the left kidney which is at higher level, okay? And the right kidney is close to the inferior vena cava, left kidney close to the abdominal aorta. Now, the kidney has anterior lateral. This is the anterior lateral surface and this is the posterior medial surface, okay? Anterior lateral, posterior medial. The posterior medial surface is flat when you compare to anterior lateral. Anterior lateral is more rounded surface, okay? This is the medial surface, medial border, which is concave. Here it's concave. And this is lateral border, convex. This is the upper pole and this is the lower pole. Upper pole related to the suprarenal gland. And upper pole is close to the vertebral column in the midline, okay? Now, coming to the relations, okay? Anterior relations. So, anterior relations of the right kidney. Anterior relations of the right kidney. How many organs? 5, okay? The first one will be right suprarenal. Then you have liver, here liver. Then here you have duodenum. Second part of duodenum, okay? Then here you have right colic flexure or the hepatic flexure, okay? And then you have coils of jejunum, okay? So this is 5 relations, anterior relations, okay? Now here, coming to the left, you have 6 relations. So the left suprarenal, then you have here it will be stomach. This corner will be spleen. Here it is pancreas, okay? Here it will be the left colic flexure and the descending. Learn it as one, left colic and then descending. And here for coils of jejunum, okay? So that's over about anterior relation. Coming to posterior relation. Posterior relation is related to, here we cannot see, here if you come, there are ribs, okay? The ribs will be, for the left you will have 2 ribs, that is the 11th and the 12th rib. And for the right, you will have only the 12th rib, okay? After that, you have diaphragm. This is the diaphragm which you are seeing, Hadirkulu diaphragm, okay? So upper part you have diaphragm. This is the, can you see this, just above the diaphragm, can you see this white line here, this one? This is the costodiaphragmatic recess. Costodiaphragmatic recess. So that's why we say the posterior relation, upper part of the posterior relation of the kidney related to the diaphragm and then the costodiaphragmatic recess. Is it clear now?
Yes.
Costodiaphragmatic recess is a part of the pleura. Okay, it's above the diaphragm. Okay, so here also you can see on the left, the left side. Okay, now what are the other? There are 3 muscles, medial to lateral. Medial muscle will be psoas major, psoas major. Then this is the, tell me, quadratus lumborum, number 2, and this will be transversus abdominis. 3 muscles, psoas major, quadratus lumborum and transversus abdominis. So 3 muscles, medial to lateral, okay? That's the posterior relation. Clear? Okay. Now let's go to the structures at the hilum of the kidney, okay? So the order is VAU, the renal vein, then you have renal artery, and then you have, actually it's pelvis of ureter, then ureter, right? Okay, so this is the order. Here also we can see the same. Renal vein, renal artery, and then ureter. Okay, clear?
Yes.
Okay, let's finish the vessels also. So here you can also see that how the left renal vein is longer than the right. Okay, and here it is also taking the venous drainage. The left renal vein drains the left adrenal gland and also the left gonadal vein. Here you can see that, okay? Here you can see left gonadal vein emptying into the left renal vein, okay? So this is called, if I mark it over here and I ask you tributaries, you should say, give me 2 tributaries, you should say left adrenal gland and left gonad. Gonad is either testis or ovary, okay? So anything can be asked. After that, this is clear now, vessels, right? And you can also see the relation of superior mesenteric artery, how it is just above the left renal vein, okay? So this can cause compression. This can cause compression, okay? So this also maybe, and we can ask you, put a point here, if there's an aneurysm, if there's a compression to the neighboring structure, what does it cause? So it causes the left varicocele. It's common to have left Varicocele. What is varicocele? Dilatation of the veins. Okay, so it's there in the lecture, but you can note it. Okay, clear? All this is clear. And the right side, the right suprarenal, the right testicular or the ovarian vein directly drains into the inferior vena cava in the right side. Okay, now let's see a live one here. So here you need to do identification, right? You don't know it's left or right, correct? So how to identify? This is anterior lateral surface. Why? Because it's rounded. And if you turn it here, the posterior surface, posterior medial surface is more flat. You see? It's more flat.
Yes.
Correct?
Correct.
Okay. So that's why this, and then you should, you can't hold it this way because this is the ureter. Okay. So ureter is facing downwards. Okay. But here, what happened is the vein is missing. Renal vein is not shown here. Okay. The renal vein is not there. Okay. Renal artery is there, and then the ureter is there.
Renal pelvis.
Pelvis of ureter and ureter. Is it clear?
Yes.
So this belongs to which side?
Right.
Right side. Okay, this belongs to the right side. But there are other specimens in which maybe all the three are there. And the renal vein will be little larger with the lumen. Okay, and I'll make another video to show you this also. Okay, clear? So here you can also observe the other thing which we studied related to the renal artery. Renal artery, when it comes here, it gives how many segments? 5. So 4 from the anterior. Here you can notice them. Can you see? Arba Majud. Okay. So you have superior, then anterior superior, anterior inferior, and inferior. And this is the posterior. This is the posterior. Okay. So you can observe that. Clear?
Yes.
I think we finished. Okay. We can't see the fascia and all that. Like nothing is, it's not.